See, I have a nephew who's 16 years of age now. He got juvenile diabetes at the age of 5, and he is on regular insulin dosage. Now, I wanted to know in what way stem cell therapy can help him to get over it.
Dr. Raheja, stem cell therapy?
This is all under trial. And as I have told you, the transplant of beta cells in the pancreas, and that is followed by immunosuppressants, cyclosporine and rapamycin, and which is again a very toxic, which has got a lot of side effects, and that is also to be evaluated. And let's see in future what comes out. It's basically under trial with the National Institute of Health, USA and Canada. They are doing all this research.
So I believe as of now there is no sure shot cure for diabetes.
Yes, as of now, today you have to take your insulin sincerely, regularly, as per the advice of your physician. Go for regular checkups, have diet control, exercise.
Right.
And let's see in future we come out with some good results with the new research going on. But again, the immunosuppressant drug, like, they have got side effects also. So it's an autoimmune process. Till date, we are not really coming out with a very good result.
Right.
My wife, in fact, when she was at 4, she developed this sugar. So then, see, now she is at the age of 58.
Yes, please go on. We are listening to you.
So she is taking a medicine now. In fact, her blood sugar is about 150 or so, 160. After taking medicine, that is under control. Sometimes even after taking medicine, she feels weakness and all that.
Please your question, Mr. Majan, because in any case we are talking with type 1 diabetes, and this apparently appears to be a type 2 diabetes. But you can ask your question, but ask your question straight away.
So, is it okay of taking medicine also with these medicines, or any? She is also taking exercise.
Well, I think we've said that already. Sure.
Yeah, I think he is talking about type 2 diabetes. And even there are studies now that over a period of time there is a very slow destruction of beta cells. And after 20 years they require insulin basically. As long as the patient can be controlled with the medicine, oral hypoglycemic agents that are in the market is really good. But it is being noticed after 15 years or so, maybe 10 years, patient may require insulin, and at that time we must add insulin to control the blood sugar levels. And for that we can add a long-acting insulin like insulin glargine, that may be supported by the oral hypoglycemic agents. She has rightly said, we must watch for the symptoms of hypoglycemia. The patient may develop weakness, sweating, blurring of vision, dizziness during the daytime, and during sleep it may go unnoticed. Patient may have bad dreams, early morning headache. So all this we should keep in mind when the patient is taking insulin or oral hypoglycemic agents, particularly in old age.
So the insulin level dips suddenly also when you're sleeping?
Yeah, blood glucose level can dip if you are taking overdose of insulin or the oral hypoglycemic agents.
Right.
So we have to check that.
Right.
And if this hypoglycemia, if this problem persists, like the blood sugar level keeps dipping below 70, 65, patient may develop convulsions and go into coma. It can be a life-threatening condition. Right. So we must keep glucose or, as she has said, the carbohydrates, rich products, juices at home at disposal of the patient, so that he can take it at a very early stage. If a patient is taking insulin and suddenly the child just tells I'm feeling sweaty, I'm feeling weak, I'm feeling trembling, we must think of hypoglycemia, and we must insert glucose to the child in the form of a glucose or juices, whatever is available, so that the symptoms do not proceed further.
Right. Dr. Raheja, if you could quickly list out some myths that are there in the minds of patients and as well as their guardians regarding juvenile diabetes, and would you like to dispel those myths?
Yeah, the most important is diet. Most of the parents, they feel this disease is because of the diet. It is not because of the diet. As we already told, it has got a genetical predisposition as well as some viral infections, coxa TB and other things. And second, we should really plan the diet of the child and physical activity accordingly. As we have already discussed that if the patient is going for a severe exercise, we must give extra carbohydrate, and if we are giving extra carbohydrate to a person who is sedentary, we must add extra dose of insulin accordingly.
Well, it's time now for us to show you a report which would recapitulate a kind of a crux of discussion. It will again show you the symptoms of juvenile diabetes and what care should be taken. The symptoms of type 1 diabetes may occur suddenly and include frequent urination, increased thirst, extreme hunger, unexplained weight loss, extreme weakness and fatigue, urinating at night, blurred vision, numbness or tingling in the hands or feet, heavy or labored breathing, drowsiness or lethargy, fruity odor on the breath. Complications. If juvenile diabetes is left unmanaged, damage can occur to eyes, leading to diabetic retinopathy and possible blindness, blood vessels, increasing risk of heart attack, stroke and peripheral artery obstruction, nerves, leading to foot ulcers, impotence and digestive problems, kidneys, leading to kidney failure. Treatment, diet, insulin, self-monitoring of blood glucose, exercise. Well, that's all in today's discussion. Before we end the program, I would like to thank my esteemed panel of experts here. So that's Dr. Raheja, would you like to say
Yeah,
something?
I would
like to be very brief. Very brief.
You know, the patient of diabetes may present with repeated infections, skin infections, furuncles, upper respiratory tract infection, lower respiratory tract infections. So we should also keep these things in mind.
Right. On this note, it's time for me to thank all three of you so that you came here and spared your valuable time in telling our viewers about juvenile diabetes. Thank you.